Occupational hazards. What is hazard? Means danger, which means if we don't control it, it may harm our body. Myself Sukumar, I am the student of occupational therapy. What are all the occupational hazards? Physical hazard, chemical hazard, biological hazard, psychological hazard. What are all the physical hazards? In our workplace, we may have heat, cold, light, vibration, radiation, noise. These are all may harm our body. How heat affect our body? Direct or indirect effect of high temperature. Heat stagnant, which means heating object is placed stagnantly. So it may cause heat stagnant, and a radiant heat. The heat or comes in a radiation way. By this way, heat is affected. After heat, it may cause heat stroke, heat hyperpyrexia, heat rashes, heat exhaustion, heat syncope. These can cause cold. After cold, it can cause hypothermia, frostbite, and transport, which means you are placed your foot in a cold for a long time, then it changes as a trench foot. Light may cause occupation, cataract, and minor nystagmus also. Pressure may cause air embolism and blast injuries. Vibration. Some vibrations may produce the rheumatoid osteoarthritis and Raynaud's disease. Noise. Over noise can make a deafness, occupational deafness. Radiation may cause cancer, genetic disorders, and aplastic anemia. Okay, these are all the physical hazards that cause damage to the person during occupation. Then chemical hazards. During occupation, acid, bases, heavy metals, solvent, particulates, fumes, and reactive metals are producing harm to our body. So if these chemicals producing any local action in any area, it may cause irritant and sensitivity. So irritation or sensitization may be happen if these chemicals are localized action. If these chemicals are inhaled, so in dust, these chemicals can be inhaled. In a gaseous form, it may be inhaled. In metallic substance, it may be inhaled. If gas is inhaled, gaseous poisoning may be happen. If coal dust produces disease, then it is called anthroposis. If the silica is produced, this means silicosis. The asbestos in our ceiling, asbestos are present. So asbestos can produce asbestosis. Iron dust may produce siderosis. Cotton dust can produce bicyanosis. Grain dust can produce formal lung. These chemicals can produce burns, dermatitis, cancer, and respiratory illness. And some metals can produce immediate poisoning. Example: lead, mercury, arsenic, chromium. These are all the chemical hazards can a person meet in their occupation. Then biological hazards. What are the biological hazards? In our workplace, there may be a chance of having the bacteria, virus, fungi, and hazardous plants, hazardous insects, bats, animals, and bloodborne pathogens are may be present. And organic dust also may be present. Example: asthma. Bloodborne diseases like AIDS may be transmitted in the workplace. This virus may be spread in the workplace. Tuberculosis is commonly spread. So this tuberculosis, so the healthcare worker is getting the tuberculosis during work. So this is the occupational hazard. What are all the psychosocial hazards? Psychosocial means the person having any mental issues in their working. First, work-related stress. So stress is a common in all occupations. So excessive working time or overwork may cause stress. And sexual harassment, violence, bullying, which means emotional or verbal abuse to the person, may happen in the occupational area. Then exposure to unhealthy elements in workplace, many more people exposing in tobacco or alcohol. So due to work stress, they may have in the uncontrolled alcohol also. So what are all the factors causing stress to the person? They are all the psychological hazard. What are all the reactions they show? They may unmotivated, they feel frustrated, their patient level is missed, they may be anxious or irritable. If someone talks to them, they may get irritated. So the stress can produce by job itself, overwork, poor opportunity for promotion, or boring work may cause stress. Outside pressure, financial pressure, family pressure may make the person stress, or transport difficulties. To go to the work, the person may have any difficulties in transporting, that also producing stress. Or problem with colleagues, so they have any colleague problem in their work area, they have a colleagues problem, so that may produce effect in their health. How to prevent these occupational disease and occupational hazards? First, health protection of all workers. So we have to focus on nutrition, communicable disease control, and environmental sanitization, which means every worker should have a good water supply, good food, good toilet facilities, proper waste disposal areas. If any plant is having in their workplace, plant cleanliness should be there. Required lighting, so the workers should not work in the dark place. They have a required correct light. Ventilation, they have to work in a sufficient space. And if any more hazard are present in there, so protection to according to the hazard. If the chemical is present, so they have to clear some codes, so then chemical don't produce any harm to them. So that's like protection should be given to all workers. And we have to focus on the mental health. So worker happiness would be very important to promote the mental health. So if the employees are suffering from any mental issues, then sufficient treatment should be given to them. So health education to all persons should be provided. Then we have to establish pre-placement examination, which means before the person or getting employed, the place should be examined. And periodical health checkup. If the workers are working, so health checkup should be in periodical manner. Medical and healthcare facilities. In our work area, there should be a good medical and healthcare facilities and supervision of work environment. I already said to the workers. Okay, in our video, we discussed about what are all the occupational hazards and how to prevent the occupational diseases. In our next video, we will discuss about further topics. Thanks for watching. Tata.